All right, fasten your seatbelt. Lots to get to today here on Monday, November the 23rd, when I thought we might kind of kick back and talk about cash cars, but we've had a ballooning in our number of cases lately. We're going to talk to Dr. Sanders about that, and we'll be reviewing the dashboard. You'll hear a reference in our conversations to it not being updated yet. It actually was updated in the middle of our conversation, as you'll hear, so the current numbers are posted. And after we finish playing the conversation with Dr. Sanders, I'll go through the press release that also came out after we were done talking. So that's all on the way here. The daily briefings heard in the 1, 5, and 8 p.m. hours on the radio, KLAM and KCDV, and also uploaded to our YouTube channel as soon as possible, youtube.com/Cordova TV. Well, I've joked, Doctor, that we, can never predict anything in this year. I had hoped to be bantering about cash cards, and 2020 said, oh, yeah? So what is the story now on this sudden ballooning of cases?
So since our last report, our dashboard update on Friday, we've identified 6 additional resident cases. That brings our active cases to a total of 10. We're seeing increased transmissions throughout Alaska, as well as this cluster here in Cordova. We know that there are cases out there that we haven't identified, and we're urging everybody to use extra caution to help us contain this.
Okay, do these cases appear to be connected to each other, or has it become more random, which of course is always the thing that we worry the most about and want to avoid the most?
Most of the cases seem to be connected. However, we still have a couple of travel cases and at least one random case.
Okay, so would you say then that the threat of community spread has increased with this recent batch?
Yeah, so we certainly are concerned with community spread. We also know that right now we're seeing the effects of behaviors from the last 1 to 2 weeks. So the concern is that we're going to see more cases over the next 1 to 2 weeks. In addition, we're coming up on a holiday that we do anticipate that some people will still make the choice to gather. And so that certainly is concerning in terms of how this is going to continue to spread here in Cordova.
All right. And as of the time you and I are recording, this data was not on the dashboard. Hopefully it will be soon. Is there any concern about the alert level changing or anything to do with school operations or significant changes? What's on the horizon?
We've all been working really hard to just understand these cases this morning, talking to the public health nurse about the contact tracing, and we do anticipate that we will be increasing the local alert level to be more in line with the local alerts in Anchorage. We developed a 5-level system when our unified command was working together early in the pandemic. So for us, if we move up to the next level, which is the level 4, which is high alert, it's very similar to what Anchorage has is their level red right now. That high alert would not be a mandating or a closure of businesses, or what it would be is more a asking everybody to be extra cautious and asking individual businesses to make their decisions of how they can best safeguard both their business and our community. These decisions, when Unified Command is working to figure out should businesses remain open or closed, it's not just a unified command decision. It's not a medical team decision. These are inherently complex decisions, and they really hopefully are best left up to businesses and everybody taking that personal responsibility and just making the best choices for how they can keep their business and the community members safe.
It's been pretty clear all throughout this that that's the way Cordova and Alaska as a whole has wanted to handle things, is to try and do everything and being reliant on the population being smart, which, again, in many ways, Cordova has done better than most communities by leaps and bounds, apparently. And hopefully we can continue to do that in the wake of this case growth. How are you feeling from the medical side of things in terms of, say, capacity over there at your facility and maybe Alanka. Are we getting to a point now where that's where hospital capacity and medical capacity is a concern?
Yeah, so Alanka and the hospital have been doing a lot of testing, and that's keeping everybody very busy. For the hospital part, we have seen hospitalizations here at our facility during this recent cluster. So as we have hospitalizations here locally, we have reached out to larger hospitals, and what we are finding out is that larger hospitals are having significant staffing constraints, and because of that, they're asking all smaller hospitals to keep patients that they can safely keep that are not requiring ICU level care. And so we are seeing that we will be keeping patients here at our facility locally when we can safely do so.
Okay, that's interesting too, because I remember when we talked about hospitals 1,000 years ago when this was kind of starting out, the concern was not having enough beds. And a secondary concern that has gotten a lot more attention recently is the fact that you could still have space, but if you're continuing to expose staff to positive cases, obviously they're maximizing their using the best protective equipment. You guys know how to really do it right, how to wear the mask, how to wear the face shield. But the virus is still going to sneak through. So there's that problem, too, that there could be beds, but not necessarily enough people, huh?
Yeah, that's been a big issue really across the country and in Alaska. The staff, regardless of where they contract the virus, once you have COVID, you cannot work, and that's definitely limiting the availability of staff. That quarantine, some people are also being in a contact quarantine and unable to work. So that's something that I think our community needs to be reminded of, is that contact tracing quarantine. Right now, contact tracing is stretched very thin in the state. So there will be times that you do not get a call from the state contact tracer, and your call is only coming from the local team. If you're identified as a contact, the expectation is that you self-isolate for 14 days. There is no get a test and get out of quarantine. So if you are identified as a contact, you are expected to quarantine for 14 days. If you get a negative test, that does not mean that you do not have to quarantine for those 14 days. We are seeing a lot of people develop symptoms later in the course around day 7 to 14, and that is a very infectious period for them. The problem is often those people had a negative test, say, day 5, and so they don't recognize that they are about to develop symptoms and they're spreading illness when they're out with that negative test. So it's very important for people to follow the guidelines of the contact tracing quarantine and really adhere to that 14-day quarantine after you're identified as a contact.
Okay, and then what about travelers returning to Cordova from, well, I guess pretty much anywhere at this point since we're off the road system?
The traveler recommendation is that you get a test after arrival here after 5 days, and that recommendation is strict social distancing. It's slightly different than the contact tracing quarantine. The strict social distancing, we ask that people use curbside delivery and don't go into businesses. It's a little less stringent on what you're allowed to do in terms of personal households. Certainly, we do know that sometimes people are going to have travelers that come in and are staying in homes. We just ask everybody to be as cautious and careful as possible. I think, especially as people are gathering over Thanksgiving or having people coming into their homes, it's really important. Just because you decided to take that risk to increase your bubble or have people in your household, it doesn't mean that you can't still practice some safer interactions by increasing ventilation in your household, by having windows or doors open, trying to still maintain that social distance and keep 6 feet. Consider using masks. I know that's kind of hard and awkward to do in our own homes, but certainly if you're having high-risk individuals into your homes, I would encourage people to still wear masks and wipe down high-touch surface areas and wash hands frequently.
Okay. So, I mean, similar travel guidance, but being identified as a contact sounds like kind of the main message that you want to get out today then, that it's important to to not consider, if you're identified as a contact of somebody who is positive for the virus, negative tests don't mean that you think, oh, okay, I'm fine, I can just go around.
Exactly.
Okay.
One other thing I wanted to make sure I touch on is that the schools really have excellent plans in place. They are following their plans. At this point, we have not identified any additional cases in the school system, and the schools will remain open and will continue to follow their mitigation plan.
Okay. And I'll point out, too, I've been continuing to refresh the dashboard, and it is updated now, and shows that we have 10 active resident cases and 0 non-residents, with 2 hospitalizations and then that 1 fatality we talked about. I can't remember if it was last week or the week before. It's always so hard to keep it in one's head. Okay, so that data is there, and we'll see if the full team decides at some point soon to raise that alert level, as you mentioned. It sounded like it was likely, but that presumably will show up on the dashboard once a decision is made. Any final thoughts? Anything else you want to leave us with?
Yeah, I think at this point, everybody tends to watch the alert levels and watch these things. What I think as a community member and as somebody who's been going through this all year, I know it's exhausting. Everybody is really sick of having to be isolated and not gather with loved ones. We know that this is hard. We also know that we are capable of slowing the spread of this illness and helping keep our hospital capacities intact. So there is some positive news with the vaccine on the horizon, and I think we're really getting close to some great breakthroughs, but we need everybody to keep helping us a little bit longer and practice that extra caution to help us contain this week.
Okay, well, we'll keep in touch with you, of course, and want to thank you for your time, your expertise, clarity, all of those things that come from having a chat with you. Hope you stay safe and don't get completely burned out, and thanks for the info.
Thank you.
All right, now, as I mentioned at the top of the show, the press release on this most recent growth in cases came in while the doctor and I were actually recording this program. So let's run that down so you know this too. The medical response team has identified 6 additional resident cases, making the active case total 10. We're seeing an increase in COVID-19 cases in Alaska, including a cluster of community-transmitted cases in Cordova. The Cordova Unified Command put a plan in place early in the pandemic that includes a 5-level alert system. We're now moving from a yellow 3 to an orange 4. Currently, the city of Cordova is not mandating a closure of businesses or public spaces. Decisions as to whether a business should remain open or closed are inherently complex, and the city doesn't intend for the change in the alert level at this time to instruct businesses across the board. Businesses should, at this time, exercise diligent COVID-safe practices. As conditions change, further information will be available. The schools remain open and continue to follow their mitigation plan. No additional cases have been identified in the school system. The Cordova is at an especially important point in managing COVID-19 and how it affects our community. Our goal is to keep all Cordovans safe, and we're asking for both individual cooperation and the support of our community. It's vitally important during this time that as a community, we follow COVID-safe practices. Please keep your bubble small and reduce contact with others as much as possible. If the case count continues to grow, level 5 measures will be considered. So that's the news release that came out from the city on November 23rd. It was at about 12:30 or so that it came out. And again, the dashboard is showing 35 cumulative resident cases with 10 of them active, 24 recovered, the 1 fatality, and 2 hospitalizations as of the latest update. On the non-resident side, it's 14 cases with none of them active. So that'll complete our update. Heard in the 1, 5, and 8 p.m. hours on the radio and youtube.com/Cordova TV for the online posting. Thanks for listening, and stay safe. We'll get back to regular programming.